Have you ever found yourself going to therapy and then freezing, shutting down, zoning out, spacing out, or just kind of generally being like, what on earth did we talk about? Or have you been like, why is this not working for me? Like, we tried this intervention, we tried a visualization, like the safe, calm place. And as soon as I tried to visualize something safe and calm, I ended up in like this other place that was not safe and it was not calm. Or I tried to visualize like working with a container to compartmentalize like trauma material. And all that happened was the container would like come apart, or just the idea of a container was too much. Well, if so, then this video is for you. I'm going to talk about some of the common signs that someone might be dissociating in therapy and what we can do about it. And I'm going to do it while using some of my favorite fidgets, which are very useful when we're dealing with dissociation. So, first, what is dissociation? Dissociation is a defense mechanism. It is a brain behavior. They can study it and they can image it. Basically, it is a way that we can cope with extremely stressful situations by detaching in some way or by disconnecting in some way. This can look like us having an interruption in memory, um, including like the inability to form a memory in a traumatic situation. It could look like separation from our emotions, our thoughts, our body sensations. Um, it would take me a lot of time to go into this. So, just to say, it is something that people do. They can study it in animals, and it is protective. So, I think it's good to not have too much stigma around dissociation, even though there has been a lot around it in the past. So, this is how it can show up in therapy. I think so in therapy, especially if we're working on trauma or a topic that's really challenging. Dissociation might show up because we've done too much too fast. Or maybe it's just like a hard day or how you kind of respond to the material. If this happens, like it's no one's fault. I like to think of dissociation happening in therapy as kind of like oh, now we have some information, we have some data. Okay. So if we were talking about whatever topic and someone starts to get really tired, they're yawning, they're falling asleep, or they're zoning out, right? You get kind of the stare. I'm not exaggerating. Some people, when they dissociation, they do this like fixed, wide-eyed stare. It's actually good to know about that. Or like their body motion kind of gets locked, or they slow down. These are all some signs that it's like, okay, let's stop and let's see. Like, is this dissociation? What might be happening right now? If you notice it in yourself, and we don't have to necessarily label it as dissociation if you haven't already kind of worked with a mental health professional to know that that's what it is. We can just kind of bring it up with the therapist because to me it's a sign that maybe we're outside of the window of tolerance, which is kind of the realm in which we feel like we can think clearly, we can problem solve, we can provide consent, we can be in touch with our emotions, in touch with our feelings, have a sense of like continuity across time, some sense of like our environment, the safety in our environment, and our relationship to other people, and like that awareness. So all of those things are generally speaking available to us in our window of tolerance, although everybody's different, right? So your window of tolerance might look different from mine. But the idea being that dissociation is part of this shutdown or freeze process when we're under too much stress or we've activated something traumatic. And ideally in therapy, we work on coping and processing what's happening in order to return to the window of tolerance, because that's where the integration can take place. And often a big piece of trauma therapy is being able to connect the thoughts, the emotions, the body sensations, the pieces of memory, the images, right? To start to kind of weave them together and also, challenge some of the negative beliefs that maybe we formed from the event. Um, look at it together. And in my opinion, like the purpose of therapy is to do that in a way that's safe, where we kind of maintain an awareness of the present moment and also the past. And that is a part of, general trauma theory as well, that it's good, generally speaking, for us to try to, monitor dissociation in the moment so that we can make sure that we're trying to do this in a therapeutic way that's not going to cause more harm. Because if we're dissociating a lot in therapy, we're likely not learning in that moment the full amount that we would learn otherwise, or we might not be able to, really participate the full way that we would if we were, more regulated. But I want to say, like, it's not like a something to have shame about. It's just a dynamic, and therapy is about kind of working with these different things that we do to protect ourselves and seeing, is there a different way for us to work through it? How can we care for ourselves in this moment? So, grounding exercises are a great option. If we notice that we are dissociating in therapy, um, something like this, a fidget. I always have like different ones in my office or around my workspace. These are helpful because it encourages us to get like in touch with our sense of touch, or smell. Also, orientation through space. And sometimes having like different types of textures can also be grounding because you're orienting to like different textures, different temperatures. Um, Other grounding things are to use like taste or smell. Um, just think about all the different ways we can kind of sense. Also, like some gentle movement can be helpful, like wiggling fingers or wiggling toes. Progressive muscle relaxation can be really helpful. It's where we kind of tense and then relax the different muscle groups in the body. And they do have a lot of free videos on how to do progressive muscle relaxation. The cool thing about progressive muscle relaxation is that it's also helpful for anxiety. And so having things too that have like some hardness, some roughness, just different textures can be useful. Other things that can help in therapy are to just kind of do some deep breathing together, to tune into the present moment safety. How safe is the environment that we're in together right now? To tune into like the relational connection, like how far away do I feel? Can you see what it would be like to kind of try to connect with me a little bit more in this moment? And also to measure like how far are we in the past versus in the present. So sometimes just asking ourselves these questions can help us get the awareness of, oh, right now I am very much in the past. Let me try to see if I can take a step more into the present, come a little bit more into the present. Notice the colors on the walls, notice the plant in the corner, those kinds of things. And I wanted to say too that with EMDR or with like trauma therapy, we can just do things a little bit differently if there's dissociation present. To me, it's kind of like knowing, if someone's like a visual learner versus someone's an auditory learner. Like we just know, okay, the inner world has a tendency to do this dynamic. And so let's do things a little bit differently to make someone have a better experience. Sometimes too, it can be helpful to like journal after session or do some kind of art to help process what was covered. And I just wanted to kind of wrap up the video by saying that, dissociation in therapy doesn't mean that, you're broken. It doesn't mean that you can't heal or that therapy can't help you. If you are dissociating in session or you think you might be, I would just encourage you to talk to your therapist about it, or what you think you might be experiencing. And then the two of you can figure out together what might be happening and how you want to work through it. Thank you for listening. I hope this is helpful. If it was, please feel free to like or share the video or subscribe it. And if there is another topic that you would really like me to do a video on, please feel free to leave in the comments. Thank you.